right, in this video, we're going to continue going over GI medications. So next up are antiemetics, which are medications used to prevent or treat nausea and vomiting. So the one I would know is ondansetron. So it is used to treat or prevent nausea and vomiting related to chemotherapy, radiation. You can give it to post-op patients to prevent nausea and vomiting. I also took it while I was pregnant to treat my nausea and vomiting. So the mode of action is that it blocks serotonin receptors in the CTZ, which is the chemoreceptor trigger zone. Side effects can include headache, dizziness, and GI upset. Key point is you want to administer this medication prior to giving the patient chemotherapy. So you want to be proactive and give this prophylactically instead of treating nausea and vomiting that is already happening. So the way I remember this medication is that I threw up on Dan. I don't know who Dan is, but he's very unlucky because I threw up on him. So I threw up on Dan, and that helps me remember ondansetron. Okay. Laxatives. So there are a variety of different types of laxatives that I would be familiar with. One is psyllium, which is a bulk-forming laxative that softens the stool and increases bulk. Then you have docusate sodium, which is a surfactant laxative. We use it all the time in the hospital. Pretty much everybody gets docusate sodium. This softens the stool by increasing water content. And then we have bisacodyl, which is a stimulant laxative, which stimulates peristalsis. And then you have magnesium hydroxide, which is an osmotic laxative that draws water into the intestine and also promotes peristalsis. You just have to monitor the patient for signs and symptoms of magnesium toxicity because this is made of magnesium. So key points, laxatives would be used for constipation. They would not be used, they would be contraindicated for any kind of bowel obstruction. Also, you want to encourage your patient to increase their fluid and fiber intake and engage in exercise because all of those things will help prevent constipation. One other laxative that I want to highlight here is something called lactulose. So you can use lactulose for constipation, but more times than not, it is used for hepatic encephalopathy. So it is used to decrease ammonia levels and improve the mental status of patients who have hepatic encephalopathy. So the mode of action of lactulose is that it lowers the pH in the colon, which in turn promotes ammonia excretion. So we're getting rid of that extra ammonia, which is causing the confusion in patients. So it should improve their mental status. Side effects can include GI upset, electrolyte imbalances, as well as hyperglycemia. Okay, let's talk about some antidiarrheal medications. So one is loperamide, and then another one I'd be familiar with is difenoxylate plus atropine. So the mode of action of these medications are to stimulate opioid receptors in the intestines, which causes a decrease in motility and increased absorption of sodium and water. So side effects can include constipation, like if we do our job too well, we can end up constipated, and drowsiness. At high doses, difenoxylate plus atropine can cause opioid and anticholinergic side effects. And then the last one I want to go over in this particular video is metoclopramide. So this is Reglan. Reglan is the brand name, but definitely no metoclopramide. It is used for nausea and vomiting as well as gastroparesis, and it can be used for GERD as well. So its mode of action is really important to know. It accelerates gastric emptying and it blocks dopamine and serotonin receptors in the CTZ. So basically, metoclopramide, it helps to empty that stomach pretty quickly so that the stomach contents can't come back up with GERD. I actually tried using this as well when I was pregnant with my nausea and vomiting to try to get those stomach contents kind of digested very quickly so I couldn't barf it up. That may be more information than you really wanted to know. Side effects can include drowsiness, GI upset, Also extrapyramidal side effects, which if you recall what those are, those include rigidity, like muscle rigidity, tremors, twitching, tardive dyskinesia, and restlessness. So I didn't get any of those symptoms, but those are possible side effects with this medication. So I'm going to stop here. We will pick it up with the rest of the GI medications in my next video. Thanks.